Hi, this is Dr. Ripal Parikh with Regen Medical. Today I wanted to talk about headaches, and more specifically tension type headaches. Now, tension type headaches are thought to be headaches that can cause a band-like pain that goes around the head, sometimes even pain that goes into the eye. A thought on why people get tension headaches is stress. But as an osteopathic physician, I generally think of tension headaches originating in the neck, in the cervical spine. And a lot of folks will hold tension in their neck and trapezius, upper back area. And then that can cause headaches. It can go in the back of the head and then it can radiate around. Most folks that I see with headaches will have some sort of irritability in the back of their neck and head. Another thing that people can be diagnosed with is something called occipital neuralgia. Basically, there are a couple of nerves in the back of your head over here that when they get irritated, they can cause pain in the back of the head that even radiates and sometimes even goes into the eye. It can cause visual type symptoms. So sometimes it can even manifest as a migraine where someone gets a whole lot of pressure or exploding type feeling in their head, visual symptoms, and sometimes it can be even going into the eye. That again can be addressed by working on the neck. So a lot of what I want to do for my patients is, treat them when they have these, oftentimes with cervical manipulation, but also talk to them about prevention and the long-term aspects of this. So treatments for tension type headaches can be all over the place. You can go to chiropractors and they can manipulate your neck, and that can be beneficial. But if you find that it's short term, then oftentimes you'll have some instability in those ligaments and you need to treat those ligaments. They can be treated with medications, Tylenol, ibuprofen, Furoset, all sorts of migraine type medications can allow people to be more functional. But if it doesn't necessarily address the potential root causes of it, then it's all going to be short-term treatments. So what are some good treatments for it? So I think, again, number one is really addressing the neck. And again, if people are stressed, the neck, they're going to hold a lot of tension in there. So you've got to really, for the short term, treat the neck. Obviously, you have to work on stressors. You have to work on sleep. You have to work on eating properly. And if anybody's seen me as a patient, they know I harp on all of that. Is you've really got to do some exercise. You've got to eat right. You've got to take care of your body for this to be a long-term solution. I mentioned that if someone has short-term relief with, say, chiropractic manipulation, well, then maybe they need slightly different type of manipulation. We're really working on the soft tissues and the ligaments. So the ligaments, again, are a big part, and I really think that for the long term, the ligaments are number one. They are the ones that need to be treated, and the best treatment for ligament problems is prolotherapy. If you've listened to any of my lectures, that's a big part of what I talk about, because when you address the ligaments, you really can address some of the pain that's radiated from those ligaments and then causes muscle tension, can cause muscle spasms, can cause tension over here, and then again headaches into there. So you have to look at tension headaches in a number of ways. It isn't as simple as just a medication. It isn't as simple as just one treatment. You've really got to address a number of things to get folks feeling better in the short term. And really, truly, one of the biggest things that I like to do for folks is really set them up for long-term pain relief. So hopefully this was beneficial. Hopefully you got a lot of information out of it. Share it with your friends if you enjoyed it. And then if you need treatment, certainly give me a call. Take care. Thank you.